Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos. In this video, we're going to cover the topic of understanding and dealing with crisis in a telemental health counseling environment. There'll be two different segments to this video. In the first half of this video, we want to discuss understanding crisis, and we'll be looking at several different crisis models to give you a better understanding of what crisis looks like. And then the second half of this video, we'll look specifically at how do you carry out your crisis protocol in a telemental health environment. And so some of our objectives we want to be able to do in this video is, number one, we want to define a crisis. We want to get a better picture of what crisis looks like from the client's perspective. That way we can have a good working definition for this presentation. Also, we want to review factors that influence response to trauma. Depending on pre-trauma or post-trauma factors, people are going to react differently when they find themselves in a situation or crisis they're living in. And so we want to look at what those factors are and how they can affect the way a person responds to trauma. Also, we want to look at planning for crisis management. What are some things that you can do prior to the crisis happening to make sure that you're prepared for it? That way, when a crisis does occur, you can be flawless in executing the plan that you have created. We're also going to review some crisis intervention models, some of the more popular ones that are out there, to give you a better understanding of what those models look like. And then we'll also talk about designing a telemental health counseling crisis protocol that you can use in your practice. So first of all, we just want to define a few words. The first word we want to define is crisis. And for crisis, we want to call that a serious or decisive state where an action will have positive or negative consequences. That when we look at having a crisis is going to look different for each individual that you are working with. And so being able to establish what that crisis is, how they interpret that crisis, is going to be extremely important for you as you begin to work with them. And so sometimes the situations you're looking at are pretty serious, and sometimes they may not seem that serious to you, but for their clients, from their interpretation, it is still a crisis. And so we still want to take what they have to say seriously, to give honor to the things that they are calling a crisis, but to help them to be able to define that for them, to help them define that so we have a better working understanding of what they're looking at. Also, crisis counseling, and this is a process that has its focus the emotional ramifications of a crisis. And so a lot of times with crisis counseling, it can be done in a short term, like a solution focused type of style, where we were just trying to get the person out of that crisis mode. Sometimes it can last a lot longer than that, depending on the model that you use. And we'll look at some different models later in this video. But the one thing we want to definitely focus on is the fact that this is a process, and that this does take time, that as a person begins to deal with the crisis that they're in. And once again, we want to make sure there is a definite connection with their emotions, because if we leave the emotions out totally, they may change certain behaviors around the crisis, but the emotional part will still be there. And so we want to make sure the crisis counseling that we do will also deal with the emotional aspects. And also crisis intervention. These are steps to address the immediate problem using a variety of resources. And so we're going to talk about several different crisis intervention techniques that you can use in an on-ground environment or even in a telemental health environment as well. So next we want to look at the purpose of crisis counseling. One of the first things we want to do is to normalize their feelings and reactions. I think for many individuals, when they're facing a crisis, sometimes they feel like they are the only one that's ever been through that situation before, or they feel like they're different, or whatever the case may be. And so what I want to make sure that I'm doing is I'm normalizing their feelings for them, to help them to understand that what they're going through is typical for the situation they're in. And so normalizing that is going to be a really big part of this whole process, because once again, if we don't normalize this for them, then once again they can feel odd, or they're going to feel like that this shouldn't be happening to them in a certain way. And so that normalization of feelings and reactions is going to be a good first step as we look at crisis counseling. Next, we want to help define and prioritize their needs. When people are going through a crisis, we need to figure out and define, okay, what are your needs? What are the things you have to have right now in order to be able to survive, and then prioritize those. You imagine when we think about Hurricane Katrina, when it came through, when those individuals went through that crisis in their lives, they had to quickly be able to define what their needs were and then prioritize them. They couldn't get everything all at once. They had to figure out immediately what was a big thing they had to have at that point. And so same thing will be with individuals that you'll work with in crisis counseling. We want to make sure that we look at their needs, but once again, get them defined specifically. That way we hopefully can help them to be able to meet those needs, but also prioritize them. That way they can get them done in the right order. Also, we want to help design strategies for addressing the needs. Now that we've normalized the feelings, we've helped them prioritize them. Now we want to help design some strategies for helping them to actually get there. Because if we just help people just figure out what the needs are, but we never give them a plan on how to get there, then we really have not been that much help at all. And so we want to look at what strategy do we put out there? What are some coping skills that they may end up using to help them to deal with those needs they have? And so we want to make sure that's well defined for those individuals. Also, helping to adapt coping skills. We want to look and see what coping skills really do work in this situation. It may be breathing techniques that we end up doing with them. There may be some other relaxation techniques that we use. But what is going to help them to cope with their emotions during that high period of anxiety or worry or whatever they're dealing with at that time period. And so helping to adapt those coping skills is going to be really important, because I think all individuals have some type of coping skills, but sometimes they're not the most healthy. And so for one individual, their coping skill may be drinking. And so that may be something that's obviously that's not helpful for them if they're doing all the time. It may become an addiction for them. And so they are coping with their crisis, but they're not coping with it in a healthy way. And so finding a healthy way for them to go through that process. And also to prevent future mental health issues. If we do crisis counseling right, we'll be able to help them to get their emotional state in a good place, and also to get to a place where there's not any future mental health issues. One thing we've seen with individuals with PTSD is that, if interventions had been taken care of earlier, then we see that these individuals may not have as severe symptoms if they have received the treatment earlier, or if the person who was dealing with them gave them some good coping skills to be able to deal with that. And so a big part of this crisis counseling is to look at preventing future mental health issues. Also, crisis characteristics. What does crisis look like for an individual? Well, for one thing, every crisis is complicated. And I say that everyone is complicated is because everyone's situation is going look a little bit different. You can have two individuals who go through the exact same situation, and at the end of the day, they may both cope with it in a different manner, because once again, it's complicated how we don't know the factors that may have led them to be in that place where they are at that time period. And so it's going to be complicated to figure out why each individual deals with crisis in the way that they do. And so just realizing that every crisis is complicated because we have the human factors at play, and those are things we can't control, but all we can really do is seek to understand them a little bit better, so we can help the individual to process through and work through the issues that they're dealing with. Also, the disequilibrium of crisis provides impetus for change, whether it's positive or negative. That whenever we help them to bring back that equilibrium in their life, this could help them to change in positive ways, or could help them to change in negative ways. And so obviously we want the positive ways to come out with the work that we're doing with them. And so we have to continue to be mindful of that crisis doesn't always have to end in a negative way, that we can help reframe their thinking on the crisis. We can help process through the emotions they have, give them some good coping skills, and they may actually see a positive come through this through that crisis versus it being a negative situation for them. But also that the brief therapy can help, but it treats the symptoms and not the cause. In a lot of individuals, when they are dealing with crisis, sometimes the type of counseling they get is very solution focused or brief therapy. And I'm not necessarily saying that you can't do that whatsoever. The problem becomes is when we are so solution focused or brief therapy focused that we just treat symptoms. And so the client comes in and the big focus is they're crying on a daily basis. And so what do? We create a treatment plan. The client will show us decreased crying over a certain time period. They meet that diagnosis, and we diagnose and we work with them on a treatment plan, and they meet that goal, and then within 3 or 4 months they're gone already because we fixed the symptoms, but we have not done anything about the cause of the tears behind that. And so we want to really be focused on the cause and what is the impetus behind the crisis they have. And it's not that the symptoms are not important, but when you deal with the cause first, the symptoms tend to go away. Also, the fact that choice is essential. I'm a big proponent of reality therapy. I like the fact that individuals have choice, that they make choices in their life regardless of what has happened to them. And that's just kind of my theoretical orientation. Everyone's theoretical orientation will look a little different when it comes to that. But I believe choice is going to be essential for individuals to realize that they're making choices. They didn't choose to be in the situation they're in. They didn't choose for these things to happen to them. But they do get choices on what they're going to do after the fact. And so when we continue to help them to see that choice is essential, this helps them to grow. And for many individuals, this takes away the ideology of them being a victim in this scenario that they're in. And also, crisis is universal because no one is immune. The reality is, when it comes to crisis doesn't care about your sexual orientation. It doesn't care about your gender. It doesn't care about your racial background or anything like that. Everyone has the ability to go through crisis. And so because of that, we have to be multiculturally competent as we are working with individuals who are going through crisis. Also, crisis is time limited. For many individuals, this is a 6 to 8 week time period where they're in that acute stage of crisis. Now, this doesn't mean they won't continue to deal with the crisis after that 6 to 8 week time period. But what it is saying is that the crucial part of it, or the acute stage of it, usually it hopefully doesn't last more than that 6 to 8 week time period. And so if we see someone who is extending beyond that time period, we want to continue to assess and continue to do what we can to work that individual to see what else may be going on to make the crisis, the acute crisis, continue to extend beyond that time. Next, we want to look at 3 reactions to personal crisis. Then when we think about individuals who are dealing with crisis, there's 3 different ways or 3 different responses we can see individuals having to crisis. One of them is they cope by themselves and grow stronger from the experience. Now, this isn't something we see in every scenario, that individual are able to cope with them by themselves and grow from it. But once again, it's going to depend, what the crisis is that they're dealing with. And we do hear stories where people are able to be resilient. They're able to overcome something that's been very tragic in their life. And because of that, we see a lot of great growth from that. And so once again, I'm not saying this is impossible, but we don't always see that. But we do see that individuals can cope by themselves in certain situations and then get stronger from that experience. Also, sometimes they can survive the immediate crisis, but block it from consciousness, leading to future problems. I've heard of situations or studies done with individuals who maybe have dealt with sexual abuse or something like that in their past, or some type of trauma from early childhood. And what they'll do is they'll block out that trauma and the crises they have gone through. They do block all those things out, but they never have dealt with it in the right way. And so what ends up happening is that it ends up showing up later on in life for the individual. And so what is a good way of being able, hopefully, is that individual eventually will be working with a mental health professional to deal with that issue, but that's not always the case. And so we do see some individuals who do block it out. And then the third way we see is that individuals will break down from the crisis, where they end up putting their life on hold unless they receive immediate assistance. These are the individuals who feel like they just simply cannot move on, that whatever this tragedy is or whatever this crisis is so big to them that they don't see how to work around this or how to work through the situation they're in. And so they just simply don't, they get stuck in a lot of ways when it comes to that crisis. And so once again, knowing how to connect with them so they know how to get some good coping skills so they can get out of that short-term acute state and be able to put their life back on track and to begin to move forward regardless of what situation they've gone through. Next, we want to look at some different factors influencing response to trauma. And so we want to look at first our pre-trauma factors and then our post-trauma factors. When we look at these pre-trauma factors on the left-hand side of the screen, that these factors can influence your response to trauma. For example, if you've had multiple traumatic exposures, that can definitely affect your response to traumas. We see a lot of time with people who are maybe in the military or people who are in the helping professions like first responders or police officers or whatever the case may be, that they are exposed to multiple traumatic exposures. And because of that, that will influence how they deal with trauma. And so it's something because their job is to basically be in a traumatic situation all the time. And so those things can wear on an individual if that's happening to them over and over again. Or a history of some type of mental illness where they have dealing with some maybe undiagnosed mental disorder, or it has been diagnosed and they're not treating it well. That could make the trauma end up being a lot more harder to deal with. Also, lower socioeconomic status. We're seeing that if an individual comes from that scenario where their life may be surrounded by several different things that are traumatic, from just the way they grew up and the things they've seen, that they've been around trauma a lot, and so because of that, it's going to change the way in which they look at a crisis situation that they're in. Also, intensity and duration of traumatic exposure. How intense was the situation they were in, and how long did they had to be a part of that? Maybe if we're thinking about someone who has been kidnapped, for example, and that's the crisis they are going through. The person that was kidnapped for only 15 minutes versus a person that's been gone for weeks at a time. Then that obviously is going to be a big difference there in a way they end up reacting to trauma. So that's just something to consider, is just once again the intensity and duration. And also, age can play a factor as well. We do realize that children are resilient, so sometimes a situation that a child goes through, they may be able to work through that very easy because of their resiliency that they have. And sometimes maybe as we get older, we lose some of that resiliency. So age could be one of those pre-trauma factors that we have to consider. Also, we want to look at some post-trauma factors. Does a person have ongoing support? Are they doing this by themselves, or do they have help from someone else as they're trying to deal with the situation that they're in? That's obviously going to make a big difference in this person in their life if they have some other support system for themselves. Also, the opportunity to share their story. There is something very powerful about narrative. When we are able to tell our stories and be able to share that with someone else, and that our stories connect with other people, and when we're able to do that, that helps us to begin to feel a part of something bigger than ourselves. And so when an individual has the opportunity to share their story with someone else, that sometimes that can be very cathartic and help them to be able to release some of the emotions that are attached to that situation because they have the ability to share their story. And so when you see maybe it's a survivors group or whatever the case may be, and they're able to share their survivor stories, there's a camaraderie that is built there because these people all come together from something they have all experienced, and the fact that they share their story and their narrative is now known, they're able to grow from that. Also, a sense of closure, and this can be done in many different ways. For some people, I've heard of individuals burying a box with memories to get rid of certain memories, to get rid of certain parts of the trauma or that they've gone through, the crisis they've gone through. And so there's different activities that are out there to help you to see what their sense of closure is, and if they feel like they got closure, how it can be dealt with in the right way, and it can help them to deal with their crisis. I've also heard of situations where people, maybe a loved one has passed away and the body was cremated before they got a chance to see the body. Then last time they saw the person, that person was alive, and for them, they never had a sense of closure. And so for them, the post-trauma factor becomes a lot higher for them, because it's harder for them to deal with the trauma they've gone through, because there was not a sense of closure. Also, the media exposure, like how much media exposure do we have? I'm in the belief that we are almost too overly exposed to media. Prior to our digital age that we are in right now, there was a time whenever something would happen, it may take a few days for you to know about it. But now, as soon as anything happens, your Twitter will light up, and you'll see something on Facebook or whatever the case may be. You see all over the place on social media, where it's instant for us to be able to see what has happened. In many cases, and people are using such things as Facebook Live, for example, or Instagram Live, whatever the case may be, where not only do you know about it and hear about it, you can actually see it, or you can go on YouTube and watch the video of it over and over and over again. And so the media exposure to these situations can once again be a post-trauma factor. Also, substance abuse and the use of substances after a traumatic event. We do see some individuals who end up turning to substances and use those substances, and that becomes a coping skill for them to be able to focus on. So they want to focus on the issues that they're dealing with. And so that not necessarily that this is a positive thing or anything like that, but for many individuals, this is something they do find themselves kind of stuck because they're using the substance over and over again. And so we end up seeing addiction can sometimes come from that. And so just something to think about. And also re-exposure or re-victimization, that maybe someone has been through sexual abuse before, gone to counseling, been able to deal with it, then they are re-victimized again or re-exposed. This can be a big factor for them. I've heard of situations where people have been doing sexting or whatever the case may be, and their pictures of themselves, or they thought they would send them to only one individual. That person ended up sending it all over the place, and they didn't realize it. Then later in life, they find out their picture is all over the place on the internet, and there's not a thing they can do about it, because once it's out there, it can't be pulled back. And so they're being re-exposed to this trauma that they've had, and so that becomes a problem for them. And so regardless if they're pre-trauma factors or they're post-trauma factors, we have to realize that individuals, depending on the factors before the trauma or after it, can influence their response to the trauma that they're currently going through. Also, there's potential for some long-term effects. Sometimes there's free-floating anxiety and hypervigilance when someone is going through a traumatic experience, and just being aware of that anxiety, that everything that they seem to be going through can cause anxiety for them. Also, the underlying anger and resentment. We look at anger as being a secondary emotion, that usually when someone's angry, either they've been violated or they've been threatened, and so if they've been violated or threatened, they seem to be showing anger because of that, and resentment towards other people, and just learning how to get out of that cycle of anger and resentment, because it's an important piece of their recovery. Also, uncertainty about the future. Everything this person understands and knows about life looks and acts a certain way, and now it's all been changed. And so what does the future look like for me? Now that my life is not the way I thought it was going to be, or things didn't turn out the way I thought they were going to be, then the question now becomes, what's the future going to be? And so that uncertainty can cause anxiety and sometimes depression for individuals that can last for a long time. Also, prolonged mourning or inability to resolve losses. That can be another issue for them, where that mourning process continues to go a lot longer than what seemed to be normal. And so it's hard to put a time limit on mourning, but sometimes we see individuals will continue to be in this state of mourning or state of perpetual mourning, and once again not knowing how to resolve the losses that they have occurred. Also, the diminished capacity for problem solving. One thing I've noticed with individuals who are going through crisis is when other parts of their life begin to spring up and they're having issues there and they're having to make decisions, it becomes a lot more difficult for them to do that because they have that diminished capacity for problem solving. That it seems like everything becomes a hard life issue, and they're just not really able to know how to function, how to deal with the problems and how to fix their problems in life because their capacity has now been diminished. We see isolation, depression, hopelessness begin to set in for some individual, and those things, if not going unchecked, can definitely lead to health problems. We've heard of people getting ulcers and things of that nature, and a lot of it comes from the anxiety they have from some type of trauma they've experienced, and so that can be an issue for them. And also significant lifestyle changes, where this person now begins to behave totally different from what they have in the past, and they've changed their lifestyle completely because of their trauma or crisis they've gone through. And so these are just some of the potential long-term effects of trauma and crisis if they're not dealt with in the proper manner. Next, we're going to talk about planning for crisis management. That the reality is you will find clients who are in crisis mode, and so part of that was to get ready for that is to have a plan for that. And so we have to be able to ask the right type of questions. You learn in your basic counseling skills class that there's a certain type of questions that we need to ask. Being able to ask good open-ended questions, and sometimes closing-ended questions, depending on what the question is, can be helpful for you as you're working with clients. And so when it comes to the what, when, why, and how, sometimes you have to be able to know when to ask those and the purpose behind those questions so you can get the information that you need. Also, identifying those precipitating events, that when the client comes in and they're talking about the crisis, we want to get as much background information as possible to identify what were the things that led up to this crisis. What was your life situation looking like beforehand, so we can get an idea of hopefully where they're trying to go back to before that crisis. Also, establish goals and operational definitions. And I think this is extremely important. I think we all understand establishing clear, measurable goals, that we have to have those. But operational definitions, I think, is something that we can sometimes struggle with. That making sure that when our clients are using certain terms in therapy, that these are terms that we've kind of agreed upon. That way we know exactly what they're talking about. When they begin to talk about the worst day ever, we need to be able to know, what does that mean? What was that worst day ever? So we can have a same or a common vocabulary. That way we're able to speak to each other and understand what the other person is talking about. And also create a crisis response plan with clearly identified steps becomes an important thing. And we're going to look at a little bit that more specifically in the second half of this video. But making sure that this response plan is clearly identified. That step one, this is the first thing I'm going to do. Step two, we'll do something next. And that way it's clearly identified and you know exactly what that process is going to look like for you. Also, to create and implement response protocols. It's going to be important for you to have a good crisis protocol and know what needs to happen when you put in, and when to put that into place. I know a lot of therapists who do have crisis protocols, but they don't ever put them in place, or they have a lot of situations where crises occur, but they have zero protocol. They just kind of wing it. And so you want to make sure you have something that's written down that you can go by. And also making sure the client has a copy of that as well, so they can know what the process is going to look like for them. And also begin ongoing evaluation and mitigation. To evaluate this situation and see, are things improving? Do we need to change the path that we're going down? Those things become extremely important in this whole process of planning for crisis management. Also, want to look at some crisis intervention models. There's a few different ones where we want to look at today. And as you go about choosing a crisis intervention model, they need to address these three things, and assess these three things. First, it needs to look at equilibrium. because when we look at disequilibrium, it creates a need to regain stability, and so this crisis has thrown them off. So we want to know, how do we get them back into a normal groove of life? And so the crisis intervention model we have needs to really lay out very clearly, what does equilibrium look like for that individual. And also cognition, because faulty thinking may need to be changed. We see sometimes when individuals begin the all or nothing thinking in this stage, and when they are going through some type of crisis. And so we want to make sure that they're thinking in the right way. And so the crisis model you choose needs to have a cognitive portion to that as well. And also psychosocial transition. And this just means that internal and social change may create a need for new internal coping mechanisms that are adequate to the demands of the crisis. That what are the coping skills we have? Do they fit the person that you're working with and the situation they're going through? And if they're appropriate, great, continue to use them. But if they're not appropriate, then the question then becomes, why are you continue to use those in that certain situation? And so we want to make sure that we are using the correct type of coping mechanisms. So equilibrium, cognition, and psychosocial transition. These are three parts of when we go to assessing and addressing issues in crisis. Your model of crisis needs to affect those three places. First, we'll look at the FEMA crisis counseling model. And on our last slide, you'll see the information from where this came from. This FEMA crisis model, it helps people to understand what they are experiencing. This is a model that has been out for a while, and the purpose is they know when different crises happen in our society. FEMA, is one of the first, hopefully, on there to the situation to help first responders. And so they want to help people to understand what they're experiencing. If they're experiencing depression, if they're experiencing shock. And some people don't know what that feels like, so they need to know what that looks like, and so explain to people what they're experiencing. And also help people to explore ways to cope. Once again, we keep that term of coping mechanisms continues to come up over and over again, but we want to explore different ways to help people cope with the situation that they're going through. And also can prevent long-term mental health problems by returning people to pre-disaster levels of functioning more quickly. And I think that the key term here is returning people to pre-disaster levels of functioning. That's what we want to get them to. Now, can their life look exactly the same way it did prior to the crisis? Most likely not. It's not going to look the exact same way. But we do want them to be able to look at their life and be able to say, I have to find my new normal, and to help define what that new normal is going to look like for them. And as they find their new normal, it may not be what their life used to be like, but we want to try to get that as close as possible if their life was a healthy place before then. It also normalizes people's reactions. That, once again, we talked about that a couple of slides earlier, that it's important to make sure people's reactions are normalized so they can realize that what they're going through is normal, that the emotions they're feeling that it's normal for them to feel that. So if they are feeling anger, if they're feeling depression, or whatever the case may be, those things are appropriate in the situation that they're in. Also, validation affirming people's reactions. We talked about that a little bit. It kind of goes along with normalizing people's reactions, and also offers practical assistance. And once again, what are the immediate needs these individuals need to take? And so this is what the FEMA crisis counseling model looks like. Also, there's the 6-step model of crisis intervention. And so the first part of it is just assessing through counseling, that we're trying to assess in general where this individual is at this crucial point in their life because of the crisis that they are going through. And then the second part of that is what we call listening, which is one of the basic skills of counseling. And we listen to define the problem. It's kind of hard to help an individual work on a problem if we have not defined what that problem is. And so we want to make sure we define specifically what that issue is or what the problem is for the individual. Also, we need to ensure client safety, that we make sure they're out of harm's way or that they're not a harm to anyone else as well. And so ensuring client safety is important, and you do that by listening to what the content of what the person is talking to you about. And also just to simply provide support. Not every situation does a person want fixed. Sometimes they just want someone to listen to them. They just need an ear there for them so they can feel like they've been heard. And so listening becomes an extremely important factor for individuals in this whole process. And also acting is the third step here of those three parts here, is that you examine alternatives. What are some other ways of looking at this problem? What are some other choices they can have? Although they had their mindset on certain things happening, what else can they do now that even though that situation is not going to change? So we want to look at our alternatives that we have. Once again, given choices. And then we make plans, measurable and obtainable plans that they can be able to put into action quickly. I think it's always appropriate to make sure as we're making these plans that there's some, for lack of a better term, baby steps are lined out so the individual knows what they need to do in order to get where they're trying to go. And then I'll obtain commitment. After we've gone through these 5 steps here, we've got the problem defined, that we have to make sure they're safe. We've got support. We looked at alternatives. We made a plan. We want to make sure they commit to this process. Because if they're not willing to commit to the process or not commit to the plans, then there's no point in making a plan. So we want to make sure we can create a plan they will actually commit to. And so the assessing, the listening, and the acting, these are the kind of the backbones of the 6-step model of crisis intervention. Next, we have assessment, ABC. We want to look for the person's affect. Any abnormal impaired affect is a sign of disequilibrium. So once again, looking for their affect. What is their body language telling you when you're reading the body language? What's it telling you about what's going on inside of them? So we want to make sure we're reading their affect. And also behavior. The immobility impairs behavior. So doing something creates help. So doing something concrete helps forward movement, and so getting them into the habit of doing something of some positive behavior, it gets them from being unstuck. And so maybe something as simple as walking or going to do a certain activity every single day, whatever the case may be. But we're trying to insert a behavior here so this individual does not continue to stay stuck in a situation that they're in. And also the cognitive state. Has a crisis been made worse by rationalizing, exaggerating, or faulty beliefs? Some people have this mentality that everything is their fault. For whatever reason or another, they feel like that this situation happened because of them. If they had done something different, that they wouldn't be in the situation. And so we want to look at their thinking process. Are they making good cognitive choices at this point? And so if they're rationalizing, or whatever the case may be, we want to be able to call them out on that, and not in a rude way, but they need to make sure they need to be called out in a way that they're able to know if they're making good decisions or if they're thinking about this process in the right way. Next, we want to talk about taking action. When we do this, as we're taking action with our client, we want to see individual differences, that we're not going to treat every client the exact same way. So we seek out individual differences as much as we possibly can. And once again, that's where that multicultural piece comes in this whole process, to make sure that we are looking at individuals as individuals and dealing with them that way. Also assessing yourself, making sure that we're in a good place as well as we're working with clients who are in crisis, that if we have any of our own things going on, we want to be aware of any transference or counter-transference as well. That way that doesn't come into the picture here. Also, to acknowledge client safety as well becomes an important piece of this process, and to make sure that the client is feeling safe, and that the things they're saying and the behaviors they are doing are leading to safe and healthy behaviors. Providing client with support, that's going to look a lot of different ways. It may be a listening ear, it may be physical needs being taken care of, but making sure that is being done. We talked about already defining the problem, considering the alternatives, and also planning action steps. Those 3 things become a very important piece of taking action. Also using client coping skills, the strengths. If they have some positive coping skills already using, there's no point of recreating the wheel. So we want to make sure we get them to continue using those positive coping skills. attend their immediate needs, whatever those look like. We try to find out from them and assess the situation so their immediate needs are being taken care of. And if you're finding that there's some needs that you can't take care of, then this is where referral can come into place. There may be agency in your area or in town that can provide some different services than you can provide, and so you look to see what referrals are out there if appropriate. And also develop and use networks. Once again, this person doesn't want to do this by themselves, and so we want to get them around other people who can become a social support network for this individual. So maybe family members, or maybe friends, or maybe someone they go to church with, or someone they work with, whatever the case may be. But we get to help them to create a network they can be a part of, so they can once again grow in a healthy manner there. And also getting a commitment. That's the key term we can continue to come back to, is that getting a commitment from the client is going to be a key portion of this process. So our counselor's role, we're going to listen to concerns, whatever concerns they have. We're going to lend a listening ear to that. Continue to assess their safety needs. Is this person safe? And we're going to continue to assess for this over and over again. Making owning and assertive statements about your role. Make sure they know what your role is during this whole process of crisis, that they have a very well established boundary with you, so they can know what they can and the things you can talk about, and also what your role is and how you can help them in this whole process. Also, to deal with current client functioning concretely and objectively. Once again, this is where we have to be careful of any bias that we may have about the situation that they are in. And so if you do have some type of bias, you would need to check that at the door and make sure that we're working with that client in crisis, that we're being objective as we're speaking to them. Also, to speak clearly in the present and about the problem. Sometimes it's not always healthy to talk about the past. Sometimes it's good for us to talk about what's going on right in the here and now. And I think that's a great technique to be able to work on. It's just focusing on the here and now. What are they experiencing right now in this moment? And it helps them to hopefully not focus so much on the past, but to look at, okay, now I'm here right now. What does my future, what can it look like? And I think that gives a sense of control back to the client there. And also take immediate direct action to restore mobility and equilibrium to that person's life. And so we want them to get back to equilibrium. That's the big piece here. When it comes to surviving and moving on, now the term moving on, I don't want you to think that we're saying they'll get over what's happened. We do want them to move forward with their life. One way of that to happen is for help the client to accept the loss. And that may take years for a lot of people to accept the loss. But accepting all of the losses is very important, because they may live in a sense of they may lose their sense of reality if they don't accept the loss that they're going through. So they have to accept the loss, whatever that looks like. Also, they need to be aware of their feelings. What are they feeling right now? And that can change minute to minute, hour to hour, second to second. Those emotions could change. And so once again, it's okay for them to know that, but they need to be aware what those emotions are, and to externalize those emotions. Some people like to hold things in. I would say in the United States have a bad rap for what we teach men sometimes when it comes to crisis. One thing we say is that men don't cry. That's a message that we send out quite a bit, is that we simply don't cry. And so what happens is you have individuals who end up internalizing their emotions, and they never get them out. And so people need to be encouraged to externalize them, to get them out. If it's anger, to get that out. If it's fear, to get that out. Whatever it is, they need to work on getting that out of themselves so they can be dealt with in a proper manner. Also, help them to draw on their personal beliefs. Individuals, whether they are religious or spiritual or whatever the case may be, they have some type of personal belief system. And so I want to draw on their personal beliefs to help that to be a comfort to them during this time of need that they have. And also utilize as many resources as you can find in your area. So we spent time kind of putting down a basic understanding of dealing with crisis in general. Now we want to speak specifically to dealing with telemental health crises. And so some of the crisis intervention guidelines I want to speak to you about. First of all, is prepare before a crisis occurs. I cannot emphasize that enough. Crisis is going to happen. Don't wait until a crisis happens before you start preparing for it. So you do this beforehand. This means that I'm going to have that crisis protocol done before the crisis occurs. If my client lives in a different city from me, then I'm going to already know who are the emergency medical people in that person's area and have that information collected. So in case something does happen, I know exactly how to deal with them when they're in crisis and information to give to them. So just preparing for before the crisis is actually here. Also, crisis protocol should be covered in your informed consent. That's an extremely important piece. In your informed consent, your client needs to know this is what happens when a crisis occurs in telemental health counseling, and so make sure that's a part of your informed consent that you get out to them. And also knowing the state laws for mandated reporting and involuntary commitment. We do have an attachment in this training that gives you a list of for each state what it takes to involuntary commit people, and so you want to definitely take a look at that. But you want to know what your state law says about mandated reporting and what things you need to report, and once again what the involuntary commitment looks like. And then also know your client's location for each session. I think you cannot be overemphasized that when your client comes in, they may be meeting at their home for each session, but if you notice in the background that things look different from what they did before, make sure you find out at the beginning of that session, where is that client located. They could be in a different city, still in the same state, but could be in a different city at that point. And so if that's the case, we want to know where they are and know once again what resources that they may need if the crisis occurs while they're in that specific town. And so just knowing your client's location is every session. Some crisis intervention basics, once again, for telemental health. We want to consider, when safety is a concern, then assess the situation. We always want to make sure that we assess when there's a safety, whether that safety is suicidal ideation or is homicidal ideation. We want to make sure that we're doing assessment. We're asking questions of the individual to know, are they ready, or is there certain things that they're thinking about that could be harmful for them or for someone else. So I'm looking at their intention, I'm looking at their plan, and any behaviors that could be related to suicide or to homicide. Then I need to see if the client is ready to commit to a safety plan. If they're not ready to commit to that, then there may be a situation where I have to call in the authorities where they live, or to facilitate this involuntary hospital admission. So we just have to be prepared for that, because just because we tell a client that they need to commit to safety plan, and we show them a good plan, that doesn't mean that they're going to actually commit to that. If a client is reporting neglect or abuse of a child, disabled person, or an elderly person, follow your mandated reporter policy for your state where the at-risk person resides. And so if you're doing it in if everybody's in the same state, then know what's going on in your state and what it says about mandated reporting. If your client happens to be in another state that you're licensed in and you're doing it across state lines, once again, what is the protocol? What's the protocol for mandated reporting in that state? You need to know what that is, and if the potential victim is in another state, once again, check to know what the mandated reporting is for that specific state where they are. And also make sure your client has information such as crisis hotline, local hospital, and a local community mental health center. This is one thing the NBCC emphasizes big time, is that you want to make sure not only do you know the information, but that you've also given the information to the client so that the client knows who they can turn to. It may be a situation where you're out of town or later at night where you're not available to them, and so when those things happen, they need to have access to a crisis hotline or the phone number to a local hospital or a local community mental health center. Legal issues that you need to be concerned with is knowing the laws in your state and in your client state. What does the law state about a commitment or when it comes to what somebody's being threatened to a threat to others? In some states, it specifies immediate threat to self or others. In other state laws read in need of immediate care and treatment, which are two totally different things. And so, once again, know your state laws when it comes to on that duty to warn. And also in some states, a counselor can evaluate and petition for a client to be hospitalized involuntarily via mental health or through telemedicine or distance counseling. And if this is the case, be sure to save or have printed the appropriate file to have on hand. And so if your state allows you to be able to do that, know what the law is and be able to have the paperwork ready in case you have to use it. And if your client is not in the state where you're licensed, you may have to request services of police or the client's family to facilitate a hospital admission. And so that's going to be extremely important that if they're not in the same place where you're licensed, then once again find out the information of where they are. That way you're able to send the right type of help to them. And once again, if your client's not willing to let you know where they are for each session, then telemental health counseling may not be the best thing for them. Also, informed consent. We've talked about this a couple of different times already. There's just making sure that you cover crisis protocol in your informed consent, but you want to do that between sessions and during your sessions. I think it's a good reminder for your clients to realize what your responsibilities are to them when a crisis occurs. Also, there's different chat-based and text-based crisis hotlines that are out there, and making sure that they have access to that. And so we have a list of different resource lists for individuals that you can use as well, that you can download and talk. And in this list, it has things like Befrienders and the Samaritan Group, also the 1-800-273-TALK, good crisis hotlines that you can use when you're not there. Also, if a crisis occurs in a session, to notify the client that you may choose to send emergency services to their location if you feel their safety is at risk, or maybe even notify a third party. I can remember back, probably it's been easily 10 years ago or more, when I was a newer therapist, and I had a client, and I had a client on the phone. So I was talking to them on my home, or talking to them on one phone, and had on a cell phone the police on the other phone, trying to be able to manage a crisis for them over the phone. And so it got a little bit complicated. And so sometimes they're not going to be willing to come in, and so you have to be able to know where they are so you can send people to them, and that could hurt your rapport with the client, which sometimes I know we are worried and concerned about client rapport, but the reality is my rapport with them is important, but their life is a lot more important to me than having good rapport. And so it may hurt rapport when you send police or first responders to their house, but I'm going to do that because I want to make sure that person is taken care of. And if a crisis occurs in a session and communication is lost, you need to make sure you have some type of crisis protocol based on what information you have gathered thus far. You could be talking to the client, and they can cut you off right in the middle of the video session. And so then you need to go ahead and enact that protocol and to use what information you have to be able to get first responders there. And so that's just important for us to know that. On your intake procedures, with each new client, you want to make sure you have their full address, even if it's a P.O. box address. We want to make sure we have as much information as we can possible about their address, and if they move, make sure we're getting the information as well. If they're seeing a local doctor or a psychiatrist, if possible, try to get release information for that person. That way, if we need to get in contact with that person throughout the counseling process, if a crisis comes up, that way the psychiatrist can be involved with the whole process if necessary. And if we end up determining that the client is at high risk, we have to realize if they're at a high risk for crisis, but and they're still appropriate for telemental health or for distance counseling, we need to consider keeping the information for the closest police stations and crisis stabilization units in their file. And so that becomes important as well. That not every client you have is going to be crisis free, and so you can't just say, "Well, I'm not going to see a client because they don't sound like they're going to have a crisis." Just most likely they will have it. You just have to be able to assess for crisis, and if you feel like they're still high risk, make sure you have if they're high risk, make sure it's still appropriate for the service, and if they are, then keep once again good crisis phone numbers close by. Also, having an emergency contact person, such as a family member or a close friend who lives near the client, will be a very important thing to do. That way, if you're trying to call the client back, they're not answering the door, you might have to get the police to come out and do a well call visit, or a neighbor to go by there if you have them as down as release information. And also inform clients that if they travel and have sessions from other locations, such as from an office or on a trip, that will require you those addresses as well. And so people sometimes are going to do sessions from different locations. So once again, we want to make sure we have those addresses as well when we're working with them. Now, after the crisis has occurred, we've gone through our crisis protocol. We followed our protocol that we have. Now, what do we do after the crisis? Now the crisis situation has been resolved, we have to reassess, see if the client is still appropriate for telemental health counseling. And if they aren't, then we need to be able to make a referral. And if they are, then we can't continue. But we want to make sure that we look at that and do reassess our clients after the crisis to see if they're still available to do this. And if a client is admitted to a hospital, provided that release information is obtained, it may be wise to communicate with the hospital staff to facilitate effective treatment for your client. So you may be able to do that through telemental health, maybe even meet with the client while they're still not in a hospital to have that continuity of care. And if you choose to do online or telemental health counseling, you want to assess client for additional in-person services such as a psychiatric follow-up, support groups, or group counseling. And so you might want to spread out some of the services and broaden the amount of services that you are offering to that person because the situation has changed due to the crisis. So in review, you just want to make sure that you are prepared. Know your state laws and your client state's laws, and have some good resources together prior to that first session if possible. But if not, make sure you have to get those together as soon as possible, because once again, you want the best way to deal with the crisis is to be prepared for it. Once again, make sure you include this crisis protocol in your informed consent. That's going to be extremely important. That is always there in your informed consent. Go over in between sessions, talk about it during your sessions. But informed consent is not a one-time thing. It's something a process you continue. Also, once again, collect contact information and any emergency contact information you have before a crisis occurs. And especially if you're using electronic medical records, it's a good place for you to keep them. That way you're not having to go and look all over the place for these individuals' phone numbers. And then follow your protocol. You know, you in this video we talked about some things you need to have in your protocol, what your protocol should look like. So execute it. Make sure it's something that's going to work for the client, and assess for continued services if necessary, or refer if necessary if the client is not eligible for telemental health counseling. Well, I hope this video has been helpful for you when considering doing telemental health counseling. One of the main reasons people don't go into telemental health counseling is because of dealing with crisis online. It's a big fear for many individuals. But the reality is the crisis can be handled in an online environment or through telemental health. The reality of it is that you just have to make sure that you are doing your homework beforehand and getting prepared beforehand. That way your client is safe and the others around them are safe as well. I hope that this has been very beneficial for you.